The number one reason people lose their teeth is not because of cavities. It is because of gum disease. Gum disease, aka periodontal disease, aka periodontitis, is the most common reason behind adult tooth loss. You're probably here because you are already aware of how important your gums are, having the important job of holding your teeth in place. But before you watch this video, it might be helpful to understand the difference between gingivitis and gum disease. I have a video all about that, explaining the differences between the two, which I will link below, so keep that in mind while watching this video. So let's jump in. The great news about gingivitis is that it is curable. Unfortunately, the bad news about periodontitis, or periodontal disease or gum disease, is that it is not. So as soon as you start to see symptoms of gingivitis, it's time to take action before it progresses into periodontitis. To cure gingivitis, the treatment is to keep your teeth as clean as possible. This might start by getting a more rigorous cleaning at the dental office, sometimes called a full mouth debridement or a scaling in the presence of gingival inflammation, just fancy words for a more involved, aggressive cleaning. It's not quite a deep cleaning because if you don't have the pocket depth to do a deep cleaning, this is like the middleman cleaning. At the dentist, they will evaluate your gums to see what you need. The usual procedure is that you will get this cleaning done, the middleman cleaning, generally for gingivitis. Not always, but it's not as simple as a regular prophy every 6 months, but it's not as involved as a deep cleaning where they numb you up. It's right in the middle. After you get it done, you will come back to the dentist in about 4 to 6 weeks and they will re-evaluate your gums again. If your gums look great because you're continuing excellent home care and you aren't getting much buildup, maybe you're fine now and in the clear. You're able to continue your every 6-month cleanings. If so, that's great. Just make sure you continue practicing and working hard on your home care. Don't skip the floss or cleaning between your teeth. Don't skip it even one night. Clean your teeth as good as you can and listen to the exact home care instructions your dentist or dental hygienist recommended for you and what they felt is best for your individual routine. It's not a one-size-fits-all, and everyone will differ on what type of home care they need, such as an electric toothbrush and maybe a water flosser in addition to traditional string floss, or maybe they think inner dental aids are best for you. Either way, gingivitis will go away from your home care efforts after a professional cleaning. That's how you cure it. A professional cleaning and proper home care. But if symptoms do not improve, it could turn into something else. If your gingivitis turns into periodontitis, now it is a little more involved of a treatment plan. If there is tartar below your gum line and or you have severe deep pockets, this stuff can't be removed by a regular cleaning, even if it's a little more involved of a cleaning, the middleman cleanings we were talking about. And it especially won't be removed with a regular toothbrush and floss at home. Depending on how severe your periodontal disease is, you will need some type of periodontal therapy. For example, periodontal scaling and root planing, aka SRP, aka deep cleaning. Generally, the first treatment for periodontal disease is cleaning off all the tartar below your gums on the root surfaces and removing the biofilm from the deep pockets around your teeth. Deep cleanings are usually scheduled as 2 visits, focusing on one side of the mouth at a time. Periodontal maintenance cleanings. After your deep cleaning is completed, you'll want to see your dental hygienist for maintenance cleanings about every 3 to 4 months to prevent relapse of symptoms. At some point, they may place you back onto a regular 6-month cleaning schedule. It's possible if a lot of your perio pockets were pseudo pockets and they weren't bone loss, it was just a lot of inflammation. But more than likely, with bone loss, you'll be kept on this more frequent cleaning cycle for the long run. Bone or gum grafts or laser surgery. If your periodontal disease is super severe, to avoid extractions, your dentist or gum specialist called a periodontist might be able to add to the supportive tissues around your tooth by placing a graft, or they may be able to use a laser for periodontal regeneration. Again, with the grafts and the surgeries, these are usually only used for people with very aggressive periodontal disease. In all, the best treatment for periodontal disease is therapy that starts as soon as possible. The longer you wait, the more your gums and bone can and will deteriorate. Pro tip: if you smoke, it can totally cover up your symptoms of gingivitis or gum disease. In fact, you could be so close to aggressive periodontal disease that you're at risk of losing your teeth without seeing any signs of swelling or bleeding. So if you use tobacco of any sort, including vaping, it's extra important to see your dentist and dental hygienist for regular routine gum exams and cleanings. Lastly, science now shows us that having gum disease can seriously raise your risk of health problems, such as diabetes, stroke, heart attack, high blood pressure, infertility, and a host of other issues. So if your gums are bleeding or if you've noticed swelling, remember that your oral health and your overall health is a two-way street. And that's why I'm so passionate about making these videos for you all. Your mouth is a gateway to your entire body. So try your best to keep it clean and visit your dentist regularly, because doing this can prevent you from lots of other systemic issues. I hope this video helped you. Please like and subscribe if it did. I'll link my other gum disease videos in the bottom bar below. And if you're interested in educating yourself even more, visit my website, teethtalkgirl.com, for more articles and videos. And until next time, peace, love, teeth.